Hi everyone. Today I'm going to talk about camera and photography in dentistry. Yesterday I attended a really good course by Cline, and I learned everything which I'm going to tell you from him. Obviously it was a long course, but I'm going to condense it all into 5 minutes. At the end of this small tutorial, I will give you Ian's details and his website, and you can refer to him if you like. So thank you, Ian. So Nikhil, this is the camera. The camera has got a body, it's got a lens, and it's got a ring flash. Yeah. So on the body of the camera, you find a knob. The knob will have all these little letters on it. You will find there is something called ISO. Yeah. So what is that standing for?
I know it's to do with the sensitivity
of the sensor, and then it's got at the back of it, it's got a WB.
That's the white balance.
White balance, and then it's got this bit, which is like where you see the screen, where you see the photo. Yeah, and then what you need to look at is the side as well, where it's got M and AF. Do you know what that stands for?
Manual and
auto focus. Yeah, so that is the body of the camera covered. Here, this is the lens, this is the flash, and on the flash you will see on and off buttons. So if I switch this on, you'll have a dial. Normally it should say ETTL, which stands for
through the lens.
Yeah, electronic through the lens. Mine is a little bit different, so don't worry about that. But that's what you would want to see, and maybe you'll see a 1-to-1 ratio on there. Okay. Now, in order to set the camera for a dental photography is very precise, isn't it? Yeah. So you need to put this on manual. So can you switch it on? Okay, and put that on manual. Okay. Okay, and then once it's on manual, you have to make sure that you've got the correct settings on the screen. Okay, so F stands for
the aperture size.
Aperture size, and what does the 1 over 200 stand for?
The shutter speed.
The shutter speed. Okay, for dental photography, we need to put. That's what we need to put it on. F22 and 1 over 200. The white balance needs to be on flash. So if I press the white balance, you can, depending on what your camera is, you can just press it back and forth. Yeah, but leave it on flash. Yeah, and set. And then as I said, on the knob, it needs to be on manual. The other things like P is taking normal holiday snaps. TV is more artistic type of snaps. You're not interested in that in dentistry. If you wanted to change that setting, then all you do is with this dial over here, you just dial it back and forth, and you can see that the shutter speed changes, but we want it to be on 1 over 200. And if you want to change the aperture, just press that and then hold it, and then you can change it with the dial. So for instance, if you're going to take a portrait, you'd want this to be on F11 and let go. Okay, but for now I want to keep it on F22, which is for what kind of photography in dentistry? Any smile,
lateral views.
Yeah, lateral views. What else?
For the smile line.
So taking the occlusal views with the mirrors, yeah, and also maybe some contrast photos. So you could use all these on the when you're taking your photos. You can have your mirrors for the upper and lower occlusal views, your cheek retractors, lip retractor, and these are called contrasters. Okay, so say for instance if you've done an anterior filling, then you could have a contraster against it to do the photo very nicely. Okay, so the other thing which you need to set your camera, so let me just recap quickly. You set it on manual. Yeah, what else do? You make sure that it's on
F22 for the aperture size, 1 over 200 for the shutter speed, and the ISO is 100.
And ISO is 100. So that's the ISO. So it says there 100, and the white balance is on flash. Yep. Okay, and the side should be on
M for manual.
M for manual. And then when you're taking the photo, you have to make sure the magnification ratio for taking your anterior photos, your laterals, your occlusal views is on 1 to 3. Okay, so you just turn the dial like that, put it on 1 to 3 and lock it to place. Okay, and that is set for taking those views which I just mentioned. If you are taking very close up of say 2 central incisors, then don't change anything. The only thing you need to change is the magnification ratio, and you want to put it to 1 to 1.5 and lock it into place, or 1 to 1. Okay, and for those photos you could use these contrasters to take photos with. Okay, and then if you're taking a portrait photo, what do you set it to?
F11.
So that one will change to F11. And would you change anything else?
No.
Yeah, the ISO to 400. Yeah?
Yep.
Okay, so you press that and you just change it to 400. What else do you change? And you put it on autofocus. Okay, do you know where autofocus is? It's here. Yeah, you press that on autofocus. So this way you don't need to keep changing the magnification ratio. Okay, so that is the basic of what I learned from Ian Cline's day photography yesterday. He taught me a lot more and also how to take the photos, but I can't cover everything in this YouTube. So hopefully in part 2 we'll go over photography techniques on how to use the mirrors, the cheek retractors and lips retractors and contrasters. You can always refer to Ian Cline's website, which is www.photographyfordentists.com, and he also does courses which are www.denta.co.uk, and you can actually print some photography details from him there, and also he does restorative courses which you can refer to, and that's it for now. Many thanks for watching. Thank you, Nikhil.
Thanks.
See you next
Bye.
time.